Here is a phacoemulsification of patient with posterior polar cataract with premium IOLs. Here are some important key points counseling the patient for possibility of abandoned premium IOL if PCR occurs. No hydrodissection and use low phacopower parameters. Leave epinucleus which work as a shield and avoid polishing of the posterior capsule and be prepared for vitrectomy. By following these steps, you can minimize risks and maximize outcomes in posterior polar cataract with the premium IOLs. Here is my case. I started with 2 paracenteses and the clear corneal incision 2.4 as you can see. Then injecting the dispersive OVD forming the anterior chamber. Here is the capsulorhexis. The capsulorhexis should be between 5 and 5.5 millimeter to maintain the possibility of sulcus IOL implantation in case of PCR occurs. As we can see, our capsulorhexis is ideal. It's around 5.5 millimeter in diameter. Then avoid doing the hydrodissection. As you can see, I'm just doing a gentle separation of the anterior capsule from the cortex. Then you can do a gentle hydrodelineation to separate the epinucleus from the nucleus as you can see. Then injecting the viscodissection to separate the epinucleus from the nucleus. Then try to avoid rotation of the nucleus in cases of posterior polar cataract. Then try to feed the tip of the phaco with the nucleus as you can see, shaving, removing the epinucleus, feeding the tip with the small nucleus as you can see. Then try to remove the epinucleus and the cortex very gently, very smoothly. Avoid any turbulence in the anterior chamber. Maintain the stability of the anterior chamber all the time of emulsification of this type of cataract. You should inject OVD inside the anterior chamber and capsular bag before taking out the phaco probe or the irrigation probe out of the anterior chamber. Here is you can see using the bimanual irrigation aspiration to continue clean up the cortex very gently, very smoothly, with avoiding any turbulence or instability of the anterior chamber as you can see. Then forming the anterior chamber and the capsular bag with the viscoelastic while taking the aspiration out the anterior chamber before taking the irrigation probe. Here is shifting to another side board with the irrigation probe and you can see the aspiration of the cortex. Now also inject cohesive OVD forming the capsular bag before taking the irrigation probe out the anterior chamber. Here is the time for implanting the EDOF IOL inside the capsular bag. You can see the surgery is very well. Look at the beautiful overlapping of the capsulorhexis with the edge of the IOL. It's very clear. Then doing stromal hydration for the paracentesis and the main phaco incision. And thank you for watching.